Hello and welcome to Trustworthy AI, De-risking Adoption of AI. I'm Pamela Gupta with Trusted AI and a thought leader in AI governance. In fact, very proud of the recent world-recognized award for AI governance, J.D. Wasserman Award. I am thrilled to be here talking to you with a very, very special friend and a very special thought leader in the space of medical governance, AI governance, Dr. Nicoleta Economou. Dr. Economou is at Duke Health. She's director of Duke Health and leads the AI evaluation and governance program. The reason I'm very excited to talk to her and talk to you, Dr. Economou, is that the biggest challenge today is we have a gap between standards and frameworks when it comes to AI and its understanding and operationalizing them. So really looking forward to this conversation and welcome to the podcast.
Thank you for having me.
Absolutely. Quick background on Dr. Economou. Besides being she's the director of Duke Health, like I mentioned, leading the AI evaluation and governance program. She's also the founding director of the algorithm-based clinical decision support oversight initiative. That is ABCDS, algorithm-based clinical support decision support oversight. She leads Duke's health efforts to drive the responsible integration of AI in healthcare by establishing robust evaluation frameworks and oversight practices. Also serving on the executive committee of the NIH Bridge2AI program, and we're going to be talking a little bit more about some of the industry initiatives that she's leading. Um, Dr. Economou, can we start off with a simple question, actually? Let's talk about the ABCDS. What is ABCDS?
ABC, our algorithm-based clinical decision support oversight program, ABCDS, is essentially a program we stood up at Duke in order to govern, evaluate, and monitor all algorithms intended to be used for patient care. And it's a process that governs and evaluates these algorithms throughout their life cycle. So we started our ABCDS oversight program back in January of 2021 when regulations were not final for software as a medical device. And it has been key in order to essentially make sure that the algorithms that we're deploying are of value, that they're safe, that they're fair, and that they're useful for the end users.
Okay, thank you. Those are, as we know, some of the key challenges, right, when it comes to implementing AI, and those are unique challenges that AI brings, right? So you make it sound so simple, but we know that this is a very, very complex issue and problem to solve. In fact, we're seeing fallouts even in the news as recently as last week around uh, fairness, for example. So let's talk. By the way, is there anything else that you'd like to add about the background or, some of the other initiatives that you'd like that you are leading? Because there are quite a few, and I will put some of them in the notes of the show as well. So, for example, the assurance frameworks that you have shaped, the research, that has been published in um, various journals, etc. If you want to talk a little bit about that, please go ahead. And if not, I will include it in the notes.
So maybe I'll talk to you a little bit now about our program, if that sounds good to you, and then I
Sure.
can tie in some of the assurance frameworks. Um, so, and if you want to, because you'll probably clip this, I can just tie it into the ABCDS oversight that I just mentioned, and I can tie the program into kind of that, if that sounds good.
Perfect. That sounds great.
Okay. So, the ABCDS oversight program actually became the foundation for a new program that we stood up at Duke. It's called Duke Health AI Evaluation and Governance Program. And we basically, what we've been doing, because there's been great interest in the work that we've been doing at Duke Health on AI governance and evaluation, we started publishing some of those frameworks. And we started translating a lot of the frameworks that exist in regulated industries. Because if you think about it, clinical trials and medical device kind of R&D, they are a regulated process. And patients or subjects, rather, get consented to participate in this process. But with healthcare, um, these algorithms and that are used for clinical care and health AI are actually deployed, and sometimes there's no consent. It's not regulated. Sometimes it is. So it's a little bit of interesting, um, um, if you will, realization that a lot of things that we can actually borrow from the concepts of quality management that
Mm.
are used in the regulated industries, such as um, drug and medical device R&D, and then we can translate those for healthcare. So a lot of the work that we've been doing beyond, you know, shaping what AI governance looks like and what um, AI evaluation would look like, then is basically thinking about what the safety reporting look like and what are the policies and SOPs that we need to have in place, and how do we educate our community so that they're aware of some of the best practices of developing and deploying AI. And all of this work then started becoming very relevant, also to other organizations, as I mentioned, but then these other organizations were facing the same issues that we saw when we were first implementing an AI governance structure. So you would have data scientists, informaticists, clinical end users or other end users speaking different languages, having a different understanding about quality, about ethics. And so to your point, there's a great need to kind of like align and start creating some of this common vocabulary. And so we essentially launched, my team and I, the Coalition for Health AI. We were basically gelling everything together. There was a steer co at the moment, and then we were essentially leading the scientific and operational kind of activities so that we can convene experts from different fields, different backgrounds, in order to start thinking about, okay, what does trustworthy AI mean?
Mhm.
And how do we operationalize it? So thinking about our program, we develop frameworks and we aim to streamline health AI evaluation and governance, building beyond the frameworks also new methodologies for responsible use and oversight while raising awareness of best practices within the community.
So there are three things there that you mentioned. I'd like to just highlight that for the listeners, which is recognizing the need for fairness and governance, in your industry, the fact that it needed a common vocabulary and a common understanding for others who are in different roles across the industry and in other organizations, and then operationalizing it, right? What are the principles and how it can be effectively adopted across different stakeholders, whether they're data scientists, whether they're algorithm creators and implementers, or those who are looking at what are the algorithms based for, right? What is the business value? What is the organizational value, right? That's a significant undertaking. So thank you for explaining the genesis. Um, so what would you say that responsible AI looks like in practice at Duke Health? Not just in principle, because I know you've spent uh, intense effort and created that methodology and that explaining not just the methodology but what it means, right? What are the different terms? What is trustworthy AI? What is fair? Would you like to spend a few minutes on what does it look like in practice at Duke Health, or we can continue and because you have already explained a little bit.
No, I'm happy to. So, responsible AI at Duke is a life cycle commitment, and responsible AI is built on core ethical and quality principles such as safety, effectiveness, fairness, and transparency. And operationalizing responsible AI essentially is driven through governance. And it begins with registration, a process that enables essentially the creation of an inventory. And then from registration, AI technologies move towards evaluation, and we perform evaluation in a risk-based fashion. And when we think about evaluation throughout the life cycle, after, there's some checkpoints, let's say before deployment, then after deployment, they happen at a specific frequency, right? So it happens throughout the life cycle of these tools and as long as they're used. And then, so monitoring
Mhm.
essentially is the post-deployment monitoring is very important. Every algorithm used in clinical care, whether predictive or generative, is tracked then through this registration process, reviewed, and subject to reevaluation. And what sets our approach is operational rigor. We've built a system of multidisciplinary review committee. It almost mirrors, if you will, the multi-stakeholder kind of nature of actually successfully putting an algorithm and developing it or implementing it and then deploying it. And we also have and emphasize transparency in our documentation. So we have transparent documentation standards and continuous safety checks. And it's not just compliance, it's clinical stewardship. It's about empowering end users, educating them, managing model drift, and ensuring algorithms serve real patient needs.
That really is amazing, right? This is what we are striving for. This is what it's all about, right? That's amazing to hear, Dr. Economou. Um, Related to that then, right? You mentioned that you have taken the thought leadership and taken it to a level of excellence and driving that excellence in operations. Now, I have a question about how we broaden the sphere, right, and make this across other or other organizations. Can you talk a little bit about the fact that you're a founding member of two coalitions? One is the Coalition for Health AI, called CHAI, which incidentally is also Indian tea. So it's kind of sticks in my mind a lot more. And also the other organization that you have been instrumental in founding is the Trustworthy and Responsible AI Network, the TRAIN um, acronym for that coalition. So Coalition for Health AI, CHAI, and the Trustworthy and Responsible AI Network, TRAIN. What is the interplay between them? What is, how do these partnerships complement each other? Are they, meant for different communities or doing the same messaging, but for different communities as in technical and medical, or what is the partnership between them?
So the first thing I wanted to say is that I really cannot take credit for all of the great work solely by myself because just because of the nature of, the data scientists bringing their own kind of like angle to the table when it comes to trustworthy AI, informaticists bringing their own angle, ethicists, and users, clinicians, right?
Mhm.
You really need that depth of subject matter expertise coming together in order to actually and see all the angles and when it comes to trustworthy AI. So I really can't take credit for everything because there were a lot of volunteers and a lot of these efforts and other people within my organization, but also nationwide, right? With
Right.
CHAI, a lot of healthcare organizations with TRAIN. So CHAI and TRAIN are complementary and essential. So CHAI defines what trustworthy AI should look like. They use a consensus-driven method to create national guidance and and help with policy alignment. Train delivers the how. You have a lot of health systems coming together in order to talk about their issues and Train offers a collaborative space for healthcare delivery organizations to share their tools and frameworks to implement different best practices and standards. Um, Duke has been sitting right at that intersection, shaping the national conversation with CHAI while equipping our training partners with practical frameworks like our AI governance policy. So alongside CHAI and Train, we're also helping translate governance into action. So we now have collaborated with Avanade to develop the Smart AI governance engine. We call it SAGE, which is a first of its kind healthcare specific platform built on Microsoft Azure and Fabric. And SAGE takes the governance processes that we've essentially created here at Duke and it packages them into a solution so that it streamlines governance and evaluation, that registration evaluation process that I talked about before, in a much more easy way for other healthcare organizations to adopt. And it brings, not only structure, but also transparency to many organizations that are still managing, on Excel spreadsheets, emails, which is what we have been also doing, by the way,
Right.
and empowering teams to shepherd AI models responsibly through clinical workflows. And turning principles into practice, through some of these initiatives, taking a lot of the learnings we've had at Duke, talking to other organizations, and then seeing how we can take some of the core principles, ethical and quality principles, and implement them is something I'm very proud about because we've really been a driving force to that change.
Yeah, I would say you should be, and we all should be thankful that you are involved in these efforts, leading them. And as you said, some of them are very large coalitions. So being a part of them, these are very useful and high impact, right? Really high impact for all of us. We all have skin in the healthcare game, right? Or in this space. Um, so another question around the coalitions that you may or may not be able to answer not because you don't know, just because it's not something that anyone would have a way of gauging. But I'll ask you this anyway. What is the impact, right, of them? Is there a way to um, draw, metrics or impact in terms of who's using them? Are they, can more entities be using them? How do you get the awareness out? Because these are all voluntary
Yeah.
coalitions and efforts. So it's not, unless there are things such as regulations, right? There is really no way of driving adoption. Do you have
So
any thoughts on that? And I think it might be a good segue to talk about regulations after that as well.
yeah, absolutely. So there's a great power in coalitions, and Chai, from being kind of like a voluntary effort, has turned into kind of like a membership-based effort. Um, so, and I think that happened back in 2024. Um, but the power of it is that in lieu of regulation, and literally when we started doing some of the chai work, people didn't have the same understanding of the life cycle. They didn't have the same understanding of what's important. They didn't have the same understanding, even, be ex apart from that expertise kind of discussion that we were talking about, across organizations it differed, right?
Mm.
And so it was really powerful to bring academia, industry, and the government together into those conversations. Patients, um, we have patient advocates. So in lieu of having any regulation, having as a health AI industry a common understanding of what do we mean by responsible and trustworthy AI was an accomplishment.
Yes, yes.
And then for I mean, train has a lot of potential. I think because, when you're in Chai, there are a lot of voices being heard, but with train, it's healthcare organization focused. So being able to share understandings around what AI is working well, what AI is not working well, right? And then being able to also share, kind of like more on infrastructure and tools and methodologies that we can be using, policies. It's really important to have um, a way to discuss that openly when it's kind of in a very kind of organic when there's an organic need for it as well.
Yeah, yes, I agree. Um, that it is industry based right now, right? In terms of self-imposed um, commitment to AI safety and security and trustworthiness is kind of being driven organically and across, right? As opposed to being mandated in certain ways from regulations. But
And that is what keeps, I think, right now, that's what the power of having kind of like industry, academia, and government speaking together is to kind of strike that right balance for, because at that moment in time, it was mostly US. There were some other kind of international members, but it was mostly US. Being able to see, okay, where do we put in exactly that innovation versus quality and ethics? Because for when, in absence of any standards, there may not have been documentation. People may think that they were doing things perfectly, but perhaps they weren't testing appropriately, right?
Mhm.
Um, and so, and then all of a sudden, when you say, guess what? These are the best practices, then all of a sudden it seems burdensome to retroactively go do that, especially if you were not aware of that this is what you needed to do. So, being able to have a um, space to hear what other organizations are doing, because it's not coming from the top. This is what the government says. This is now what everybody is saying that they're doing. And then also the government to have an insight that can, it's bidirectional if you think about it. Then that can also influence and inform regulations moving forward.
I think that is the best um, path forward because it's coming from informed audience, right? That this is what can go wrong. This is our operating environment. These are the issues that can come up from bias, from security, from privacy, from transparency, right?
Mhm.
Explainability. These are the issues that are we are currently experiencing and can be problematic at scale. And not problematic in a light fashion. These are high impacts. It could be a question of life and death. It could be a question of who gets the care that they need when they need it, which can be, of course, life changing and impact life death
Absolutely.
decisions as well. Um,
Absolutely. And the devil is in the details, right? You can do the risk stratification all you want, right? But, you know,
right.
raising awareness with end users is very important. Having somebody monitoring a solution while it's being run is also important in the testing because data fluctuates
Yes.
and AI models nowadays evolve as well. So, a good example with the data is COVID-19. All of a sudden, the profile of the patients coming in and to seek care and have visits changed because people were avoiding because they were afraid of getting sick, the hospitals, and going to the doctor's office. And then all of a sudden, you had people that had issues start going in more frequently. And so when you think about AI that's being plugged onto that data, was that representative data of that time? And is it representative for subsequent years?
Yeah, absolutely. That's a very important point. I just want to highlight because AI is based on data and it learns on data. If all demographics, for example, are not represented in that data, if they're not going to a clinic or a hospital or to see a doctor, then that data is not captured and there can be big gaps in data. So if if the demographic is not represented, um, you're not going to be able to use that for better decision making using AI. So this is a very,
It's
very critical point.
it's important, first of all, to recognize that you need to do local validation of these tools.
That's
Before,
true. Yes, absolutely.
it's not like any other type of software that it's just plug and play
Right.
because it's highly dependent on the how the data, which means the patient population that of the health systems that the data belongs to. So I had another important point though, that especially for predictive AI, you statistically expect an error. And we should, for
Right.
all AI, expect errors. But I think the most important thing is being able to detect it, being able to override it. And
And know
that means,
when to do that. Right.
and when your intuition as an end user, clinical end user, whichever end user, is not on par with what the model is saying, then making sure that's being captured.
Okay. Yeah. That makes that sounds right. Not sure what's wrong with my voice, but yes, I agree that that is a very important point as well to have that feedback mechanism into into the AI systems as well, right?
Mhm.
Um, you mentioned predictive AI. Now, we're also seeing generative AI everywhere, and that includes in what does that mean in your world, right? In your areas that you're examining, and how are you approaching the risks around that, risks and opportunities around large language models, for example?
So we're definitely optimistic. Um, Generative AI holds potential for documentation, communication, and um, we need to be careful that its risks are carefully managed. So I also think it's worth mentioning that not every single AI methodology can be used for every single use case, right?
Mhm.
So sometimes you can experiment with different AI methodologies to see if they will work for, let's say, clinical decision support, but we need to check carefully that that indeed is the good methodology, or we just have preference to work on the next hot thing that's coming out of the in the pipeline, right? So that said, I think we've seen a lot of uh, great results with ambient scribing, at least from the end user's perspective. When we think about clinician burnout, right, a lot of their time goes into the notes that they're writing and, many hours during the day and through the evenings for clinicians that are seeing many patients. So being able to just have a summary of the visit that you can look at, human in the loop, and see if you wanted to add anything, if there's anything that, may be missing, or if you want to edit something, and then plugging that in is a huge lift and gives us great hope for what, the clinician burnout problem that we're facing today in healthcare. So, and ambient scribing, right,
Mhm.
is one of the solutions. Um, but we, as a governance committee, want to make sure that we have guardrails in place. The same ethical and quality principles essentially apply, right? So, transparency, accountability, fairness, that the benefits outweigh the risks. Um, and then we include internal validation and do some like limited, kind of testing,
Mhm.
small scale, in a controlled fashion, before it's deployed. Because sometimes the solutions you can't do it pre-deployment. Um, so human in the loop review, like we discussed for the ambient listening example, and making sure we're capturing safety incidences and doing benchmarking, to understand kind of like how we're going to be monitoring this tool and how it's performing. So it's not just a question of can the algorithm write, but is it accurate, fair, and safe is more of kind of the questions that we ask.
Yeah, thank you. So that, you highlighted a very important point there, which is all applications may not be a candidate for using this technology for all use cases are not, you got to look at it, weigh it out, see what are the risks and reward, and what are the, advantages, and where can it, also taking a look at it from a risk perspective, right? If it's for ambient transcription, it's one thing, but if it's for decision based on that ambient recording, then that's a different, um, risk proposition, right?
Mhm.
And also, I think you highlight something which kind of goes to the whole theme of the podcast and from what we covered at the beginning is how to operationalize that governance process, right? How to take those, what are those use cases that are on the table that is being looked at for that efficiency or value proposition, and is there a and going through that lens of what is the impact from those principles from of trustworthiness, right? Whether it's fairness or whatever is contextual makes sense for the context. So I think it brings it into a loop quite well, right? We started with this, we are going into taking those principles, but always keeping an eye on what is the process to operationalize that
Yeah.
governance process.
And if we didn't have governance to operationalize ethical and quality principles and gain organizational transparency on what algorithms we have out there, how are they working, who's responsible for them, we would be in a very different place today with AI, the rapid pace of AI being introduced into the clinic. And I
Right.
think everybody is feeling, each organization is eager to put in AI, but then also, um, I think a lot of organizations do want to ensure that we are keeping our patients in mind first and that we have a good grasp of what's happening
Right.
when AI is involved. Yeah.
So speaking of that, I'd like to conclude with one question. From my perspective, and of course, would invite you to give your closing comments. But speaking of, that governance and how do we ensure governance is being followed and, organizations understand, we are seeing some more legal and regulatory scrutiny around how AI is being used in coverage and reimbursement decisions, for example, for insurance purposes. From your perspective, um, how do we use these principles of governance, of fairness, and how should that guide insurance and health systems to ensure transparency and retain and maintain trust?
So the scrutiny is understandable because when AI is used in decisions that affect patient access and care, the stakes are high. And the principles that should guide both insurers and health systems mirror what we've built into our governance framework at Duke, which are transparency, where patients and clinicians deserve to know when AI is being used and how those decisions are made. It's accountability, where there must be clear ownership of the models and the decisions they form. Fairness, where these tools must be tested to make sure they don't inadvertently disadvantage certain populations, but overall safety as well. Not, when we think about it, because we're making decisions about the treatment, diagnosis, and prevention for millions of patients. We also need to think about usefulness and if essentially these solutions are useful and adopted, because the last thing we want is to take these AI solutions out of the clinic. It takes a lot of effort to change the whole workflow in order to introduce the AI solution. We don't want to introduce more burden into the clinical workflows. Um, and then I do think that continuous monitoring, because performance can drift over time, is important. Um, but it has to start with kind of, you integrate these, if you will, ethical and quality principles through, you know, checking whether these AI solutions are performing appropriately and meeting its intended purpose. Um, Making sure you have the perspective of the end users from the beginning, even before deployment, sometimes also in the design of the solutions. We ensure as an organization through this governance structure and through intermittent checkpoints that we have a dedicated committee with multiple stakeholders that are essentially going against the evaluation criteria. So we've translated each ethical principle, if you will, category to evaluation criteria that our review committee takes into account so that the AI solutions are meeting all of the principles. And as we mentioned before, there is no person that I know and have seen that has a depth in everything, right? So that's why it's important to have a review committee that has um, appropriate experience and subject matter expertise um, to perform these evaluations from before deployment, but also post-deployment.
That's an excellent answer. I like that. It's not about it's not about blame. It's recognizing that there is complexity and there will be change, right? How do you have the right principles in place, right governance principles? You have a way of enforcing them, operationalizing them, but then also recognizing that they can be changed and there can be model drift, there can be data drift, algorithmic changes, right? To keep, it's not a static deploy once and move on, right? It's deploy and monitor because that's going to be important to
And
stay
the
with,
key about principles is that even if you go from predictive AI to generative AI to agentic AI, the
right.
principles stand.
Right. All right. Well, this was a great conversation, and I'm certainly going to include some of the frameworks and the coalitions that you mentioned. So if somebody wants to refer to them, and it
Very,
was a very good conversation. Thank you very much.
very nice chatting with you too. Thank you for the invitation. And it
Okay.
was wonderful chatting with you, Pamela.
Thank you. Okay. Bye.